LabTV travels to the Institute for Creative Technologies in Los Angeles, California, to meet a psychologist who uses virtual reality to treat soldiers with post-traumatic stress disorder.
Post-traumatic stress disorder is a clinical condition that may occur when somebody has something really bad happen. Now, a lot of folks have these things happen, and it's bad when it happens, but eventually they get over it. Some folks, though, when these things happen, still feel as bad a month later as they did right after the thing happened. Or they may feel even worse, or they might feel even worse 6 months later. And for some reason, some people, when they have these bad things happen, they just don't get over it right away, and they need our help.
One of the best ways to treat PTSD is to help the person go back to that bad thing, go through it gently, and talk about what they were feeling. Dr. RIZZO takes them back there using virtual reality.
So what we try to do with virtual reality is we put them in this simulation, and the simulation is like a game you'd play on a computer where it looks like wherever the bad thing happened to you.
They call it exposure therapy. The person puts on a VR headset, and unless he closes his eyes, he's in that world.
Were there any passengers in the vehicle with you?
Yes, I had a passenger with me and a gunner in the turret.
Okay, why don't you take a look over there and we'll add them into it. Here we go, we'll add a passenger. And we'll look up to the turret, we'll add someone in there. Anything that you're afraid of, but really doesn't have the power to hurt you, as you get closer to it and you spend more time around it, you don't fear it as much anymore because it really can't hurt you.
And that's how the exposure therapy works. It's kind of like being in a video game, but the therapist has the controls.
Then the therapist can add things in, like maybe the sound of a gun in the distance, or a bomb going off in the distance, or a helicopter flying over. The clinician has a little control panel that makes these things happen in the virtual world.
As we approached, I started to hear gunfire.
And the patient may say, all right, I'm getting real anxious. All right, well, stop. Why don't you tell me about what's making you anxious? Tell me what you went through.
Even people who don't like talking about their problems seem to open up with VR therapy.
Now, what happened as you approached? This may draw in people to come to treatment that ordinarily might resist coming to treatment and suffer for the rest of their life.
And this new virtual reality therapy really seems to work. In one study, after just 10 sessions, 80% of the patients made huge improvements.
They feel like, all right, I had a bad thing happen, but now I'm talking about it with somebody and I'm thinking about it again, and it really isn't so bad. It was bad when it happened and I've moved on, and now I don't have to be afraid anymore.
Dr. RIZZO has created other uses for virtual reality. He's designed VR headsets and programs that diagnose attention deficit disorder, as well as fun video games that help people do physical therapy.
Now, if we can do this with teaching you how to learn algebra and geometry and physics, then we'll really be onto something, because then we can make it fun. We've taken something that started off as a toy, and now it's a treatment. That's like one of the best feelings in the world. You know, I mean, I often say to folks, you know, when I want to brag, I say I'm the luckiest psychologist in the world, because not only do I get to help people, but I get to play with a lot of cool toys in the process of doing it.
To find out more about virtual reality therapy at ICT, check out labtvonline.org.